welcome back to the Wellness Paradox podcast. I'm so grateful that you can join us on this journey towards greater human flourishing. As always, I'm your host, Michael Stack, an exercise physiologist by training and a health entrepreneur and a health educator by trade. And I'm fascinated by a phenomena I call the wellness paradox. This paradox, as I view it, is the trust, interaction, and communication gap that exists between exercise professionals and our medical community. This podcast is all about closing off that gap by disseminating the latest, most evidence-based, and most engaging information in the health sciences. And to do that in episode 119, we're joined by Drew Smithson. Drew's story is fascinating. It starts with his journey as a healthcare executive, having many major roles in healthcare systems from an administrative perspective, and then pivoting, as he talks about, during the COVID-19 pandemic towards becoming more of a lifestyle medicine provider, working with exercise, nutrition, stress management, and other lifestyle factors to improve individuals' health. The reason why I think this conversation is so insightful is it's a look under the hood of healthcare from someone who lived in the business side of healthcare for more than 2 decades that decided to make a pivot to actually being a provider using lifestyle as medicine. So many great tidbits of information, so many great gems that I think we all can pull out as we move forward on the journey to close off the wellness paradox. Any information we'd like to share with you from today's episode can be found on the show notes page. That's by going to wellnessparadoxpod.com/episode 119. Please enjoy this conversation with Drew Smithson. Today, we're delighted to be joined by Drew Smithson. Drew, thank you so much for joining us.
Well, I'm glad to be here, Mike. Pleasure to meet you as well.
So really excited to have this conversation because you've taken a path from healthcare to more kind of lifestyle medicine provider. And so these are conversations I always love to have with people when they've kind of made a transition in their career. And we're going to dive into a little bit of that right off the bat. Just give us a little bit of an idea of your background to kind of tee up this discussion.
Yeah, sure. I like to call it a pivot because we're still in healthcare. I think that's going to be part of our discussion, correct? About, how fitness and wellness all fit into the puzzle of what healthcare should be or is. So I've been in healthcare administration wise for almost a little over 20 years now. Actually, I started my career at Johns Hopkins about 23 years ago now, and I just fell in love with the administration side. But prior to that, actually, I was in pre-med. I finished up pre-med. Also, my undergraduate was in nutritional science. So that's where kind of I'm rooted into, really, if you want to call it the wellness fitness aspect, because I actually did sports nutrition as well as metabolism. That was kind of my area of focus. Back at a time where you probably remember this, creatine was kind of a questionable supplement back in the day. And I used to have a lot of discussion with my professors actually in the nutrition and actually biochemistry area about creatine. Mm-hmm. And I was actually on it with the 5 gram a day. It wasn't even back then talking about 5 grams a day, et cetera, et cetera. And that's really kind of where my love of fitness came. So I should probably caveat there a little bit to start there. Mm-hmm. And then kind of just led to where I was meeting with some physicians back in around 2000 and talking about where my path was going to go, whether it was going to go to more med school. Endocrinology is an area where, obviously, from the metabolism perspective, it kind of fits. And they said, geez, health insurance, and you're going to laugh a little bit about this because it's still the same issue today. Even health insurance and the managed care industry is making it a little bit more difficult for physicians to provide the care they want to do. Yeah. And so as a 21-year-old, I'm thinking to myself, what can I do to change that? So healthcare administration, I'm going to go in and help physicians and also try to see what I can do to facilitate them to provide better care. And that's kind of how my career started off. So over the last 20 years, I basically moved up the ranks of more of the clinical operations side. So everything from a director of operations to associate vice president of operations at a large academic, then to a vice president COO at another large teaching campus. And basically that's been my career. And I was a CEO for a short time as well. Mm-hmm. So I think that kind of gives you a good overview of my 20 years in a nutshell. Mm-hmm. So I'm pretty well versed in all things from acute care to ambulatory care, which is more clinics, and then also post-acute, which is long-term acute care and things of that sort, home care.
Awesome. But to your point, you made this pivot into a different realm of healthcare. You've started your own company, Descending Upward, which I love the name of that. Why don't you get into your thoughts behind your pivot, and then tell us a little bit about Descending Upward.
Yeah, it's an interesting story, I guess. But I think your audience will appreciate this. I think any professional will gain an understanding of what happens in life, and life happens sometimes. Where you start off like I was even in college. If you see some of my old pictures, I was pretty good, well in shape. I used to do 5Ks all the time, run 18, 19 minutes. Quite honestly, I was down around 10 to 12% body fat for a good amount of my time. As soon as I got into grad school for health administration, I was still going to the gym, came out, and then career started taking over. How's that?
Yeah.
So over the course of about 15 years, my weight slowly started creeping up. That seems to be the case with a lot of folks. So about every year, I was gaining probably about 5 pounds as I look back. But before I knew it, in 2020, and that was an interesting year for a lot of folks. I was almost 260 pounds, right at 6 foot. And by that point, I hadn't really taken good care of myself. Best way to describe it is I ended up in the hospital for a little bit myself. As soon as COVID took place, and ended up in the clinics as well, and found out that I basically had metabolic syndrome. Well, I had all the factors of metabolic syndrome, from everything from hypertension to basically type 2 diabetes to GERD, which is not necessarily part of it, but still in that realm. Sleep apnea was present for many years, frankly. A lot of things that, frankly, the average person has.
Yeah.
And unfortunately for me, I found out from my doctors, they said, Drew, if you don't start changing your lifestyle, and that's where lifestyle comes in, in the next 5 to 10 years, based off the calculators and just how you're, where your general health is right now, you're probably going to have a MACE, or a major adverse cardiac event, like an MI or even a stroke. Because my cholesterol, like everything, was just not where it needed to be. And so I made a difficult choice back in 2020 to take a pause in my career. And really focus on my health, because frankly, with what was going on in the world, I didn't know if I was going to end up in the ICU myself.
Yeah.
And so this kind of leads into the pivot. Quite honestly, it's where my life changed. I started doing exactly what I think you should do, which is I started walking every day. And then I started looking at my diet, if you want to call it that. I call it nutrition because I really think diet is just an interesting word to use sometimes. But I looked at my nutrition and I said, gosh, I got to get rid of a lot of the processed stuff that I was always eating. I was eating out 4 to 5 times a week. Again, like a lot of normal folks, highly ultra processed, very little whole food. And so I just dug through my pantry. I pulled out my old nutrition books. Quite honestly, I kept them from college, actually. I started watching actually a lot of podcasts as well to kind of just catch up on some things. And there's some really good ones out there, of course. You look at Wellness Paradox as well as an opportunity to look at things too. And frankly, as I started just kind of tearing through nutrition and exercise, and I started building up my exercise regimen as well over the course of a few months, because you can't just start off too fast,
right?
Especially at the weight I was at and things of that sort. So yeah, over the course of about 6 to 9 months, I dropped to about 185 pounds. All of my comorbidities were gone. My A1C went from about 7 down to 5.5. Now today it runs around 5. And one of the things I made a promise to myself, because I'm very goal oriented, and that's kind of how my career led to where it did, is that I wanted to do a triathlon by 2021, if it was available to do so because of the pandemic. And I did that. So in the spring of 21, I did my first triathlon. Barely got through it because of the swim, the very first phase, but I got through it because I never like to quit on anything. And yeah, that really kind of changed everything for me from between 20 and 21. I think the other thing, Mike, that I should bring up is I didn't just sit around the house either. I think it's important to say another thing is volunteering is something that's important to a lot of folks. And there's an opportunity that arose, and I still am very thankful and grateful for this opportunity. Hospice care, which is a really, I call it a sacred thing nowadays, because I really didn't have much experience in it, even as a hospital executive,
right?
Quote unquote. And they needed volunteers because, frankly, a lot of the volunteers backed out because you had to go to assisted living, to homes. I mean, just a lot of things. And it was a very difficult time. Well, because of my background, I wasn't too concerned about it, as long as I had the right precautions. And so
Mm-hmm.
I did that. And I got to listen and talk to all different families.
Mm-hmm.
And you want to talk about really learning about life and also just the value of life. And a lot of things I got to hear, Mike, is I wish I would have taken care of my health better.
Mm-hmm.
And I wish I would have done more things with my family and not just work. And I think those kind of hit me pretty hard, especially with the health component, because most of them either had cancer diagnosis, and you can't always stop that per se, and also dementia, Alzheimer's. Those are the two primary things I noticed actually that had hospice care. But just to hear what they had to say about life, that changed a lot. So I think when you take the combination of just my own life events plus this experience, quite honestly, led to this idea of my wife was very supportive as well, which is always helpful.
Mm-hmm.
I went back into healthcare administration, by the way. So in 21, I ended up coming back to Nashville and helped open a long-term acute care facility here in Nashville
Mm-hmm.
with a large organization. But after that, about a year, I just realized that my passion and that pivot you're talking about really took shape. And
Yeah.
I decided, and I talked to the group and I said, hey, this has been a great ride. I got to open up something, do some really good things, but I really want to move in this other direction, which is prevention and wellness.
Mm-hmm.
So it was a really good thank you. And that was kind of where my pivot started. And that's where Descending Upwards came up. Interestingly enough, the company, so we'll touch on that really quick if that's okay.
Mm-hmm.
Where Descending Upwards came up. I have a really good friend, former colleague, who actually, he also pivoted. We talked at one point. He's a hospital leader as well, who actually opened his own CrossFit gym basically now. And he's he's more passionate than I am. Like, I mean,
Mm-hmm.
he's very gung ho. He's got his own gym, everything. And he talked to me one day about my journey.
Mm-hmm.
He was just so fascinated by it. And he's like, Drew, you descended so far. I mean, if you think about what you went through to try to get yourself back in that especially turbulent time, that year, basically for a lot of folks, and you took advantage of it versus kind of did not. He's like, you descended, and that's where that word descended came from.
Mm-hmm.
And he's like, you should really think about that if you're going to open a business. And I said, geez. So I gave him credit. His name's John. Yeah. So John, I give a shout out to you. Fantastic gentleman. So Upwards came up from the other end because, frankly, when you think about life, a lot of times you have to descend before you end up moving back upwards again.
Yeah.
And so I thought that was very fitting. So a lot of people I now have clients with, and we can talk about that a little bit in a few minutes, they all descend. I mean, if you talk to their story, I'm sure you get to hear these things as well in your life, is that they hit a point. Mm-hmm. Whether it actually can be a lot of things, family, but we're focused on more health, but it feeds together, quite honestly. Yeah. And the stories I get from my clients when I start working with them, and actually people outside, just executives too, and others, they're all kind of going through a lot of these things. They descend, but they don't always kind of hit that point where they want to, with a health perspective, go back again, because it's very tough. I mean, it requires a lot of discipline. And the ironic thing about discipline is that to be a senior leader or a leader, let's put it that way, a manager, pick it, there's discipline involved to get to that point. And I always find it ironic that we're so good about being disciplined about work life that we're not as disciplined about our own well-being that actually takes care of our families and our overall well-being. And that's where I want to change that dynamic. And that's kind of where my company comes in. It's a model right now, because I know that's a question as well, I think, where I want to do a proof of concept. Mm-hmm. So that's what I did for the last almost 18 months now. I started with a pilot group, actually consisting of physicians. You might be interested about this, because I actually had more physicians and nurses than I did anybody else. I actually had one physician, I don't mind sharing this. He kind of joked, he's like, you're basically my PCP now. He thanks me still to this day because he has changed. I've changed, as he quotes it, his life by getting him back to where he needs to be. And we talk regularly. And some of the things I learned actually from this work, Mike, is that the challenge you run into a little bit, and I'm very cautious and I'm also very sensitive to this, is that I think doctors do the best they can, given the time they have with patients. And I'm very, very acutely aware of how that works in the budgetary world as well as the operational world. And we could talk about that all day. And I think that you hear that a lot about the burnout, where it's just not enough time with patients and too much time, obviously, with the billing aspect and the administrative component of it. And I think there's a reality to that. And I think that's where my difference is, that I give my clients every week. I don't do it, once every few months or what have you. And it's not 10 minutes or 15 minutes and then a lot of paperwork or looking at a screen, typing up in your EMR. What I try to do is we start off with labs, quite honestly. And I always say I'm not a physician, because I'm not. I'm not even an RD, even with my nutrition background, but I do have that basis in that. And what we do is we go over a lot of just the basic metabolic components. And I say, okay, let's look at certain things and parameters and say, has your doctor looked at this? If there is anything that's unusual. And because I work with primarily clinical folks over the last year, a lot of them know me. And that's where I've gotten my name out, actually, through more of the clinical component, is that there's a lot of labs out there that we don't necessarily utilize because they're not part of the standard of care in today's world. And that's changing. And I think sometimes to look at different countries as well. So I look at Europe a lot, quite honestly now, especially when it comes to cardiac and metabolic components. From cholesterol panels to, I'll call it lipid panels, really. So we use a lot of the basic lipid panels today, but more and more research is coming out that there's the advanced lipid panels, they call it, which goes into the particles. It goes into ApoB, which has become a very hot topic more now. Things like Lp(a), which is a genetic condition that, frankly, surprisingly enough, it impacts 1 in 5 adults, actually 1 in 3 African Americans. And I think that's a component that really needs to be more looked at. I will say personally, I have a personal relationship with Lp(a) because I found out that I have an elevated number, which actually has contributed to my own my own cardiac challenges a little bit. But I think there's a lot of tests out there that are becoming more commonplace, hopefully soon. But because of the standard of care and just the way that we do checkbox, I don't want to call it checkbox medicine, but we're kind of more regimented in a certain way, that physicians are hesitant to sometimes order some of these tests. And so what we try to do is sometimes I collaborate with the primary care. And what we say is, hey, have you thought about doing this test in addition to this one? Just to make sure, like, for example, glucose, fasting glucose. Well, a lot of times you'll notice, and in research, your insulin levels are going to shoot up before your blood glucose goes up. And that's when insulin resistance takes shape. And a lot of times, fasting insulin is never checked generally. But fasting blood glucose is, or A1C sometimes, which gives you a little bit further out, 90 days versus, more immediate, which is great. But again, if you can catch it early on, and that's the whole point about prevention and wellness, is trying to catch it before it gets to a certain point. And I think that's part of my goal, is to try to start bringing more awareness to that. And when using my leverage that I have, and I think that's to my background, is that's how I start to meet folks, is because I kind of enter through my own portal a little bit. And yeah, my pivot is kind of interesting to a lot of folks, because here's this guy who was basically a healthcare executive, now has kind of, like you said, pivoted completely, more clinical based, with a little bit of a business spin to it. So those are the kind of things I really focus on day to day right now.
I'd like to take a quick break from today's episode to tell you a little bit more about one of our strategic partners as a podcast. As many of you know, the Wellness Paradox is all about closing off the trust, interaction, and communication gap between fitness professionals and the medical community. And no organization does that better than the Medical Fitness Association. They are the professional member association for the medical fitness industry. Now, this is the industry that integrates directly with healthcare in many facilities throughout the entire country. The MFA is your go-to source for all things medical fitness. They provide newsletters, webinars. They even have standards and guidelines for medical fitness facilities. They do events around the entire country. And most importantly, they are one of the more engaging networks in the entire fitness industry. I personally have benefited from the network that I've developed through the Medical Fitness Association. And I highly recommend that all of you that are interested in solving the wellness paradox engage with the MFA. To find out more about the Medical Fitness Association, you can go to their website, medicalfitness.org. That's medicalfitness.org. Now back to today's episode. That's great. I love the arc of that entire story, from, being in healthcare, understanding the inner workings of healthcare system, to having your own personal health, crisis to a certain degree, and
Yeah.
realizing that the path you were on isn't the path that was going to be sustainable for you to lead the life that you wanted to lead. And now, taking that pain and then transitioning it into something that is now helping, other people address that very thing. I always found it to be very ironic that those of us that are caregivers often put our care very much on the back burner relative to the care that we provide other people. Your perspective as a healthcare executive is so unique, simply because you understand, the medical side of the system, but you also understand the business side of the system. For our audience that is interested in, integrating with healthcare as fitness and exercise professionals, where do you see the opportunities that lie for fitness and exercise professionals to integrate with healthcare? And then we'll kind of follow on with how they can take advantage of those opportunities. But let's just start with the opportunities themselves.
Yeah, that's actually a great question, Mike. I think I've kind of had to think about this one a good amount over recently, because there's a lot of multidisciplinary care, we call it in healthcare.
Mm-hmm.
We have team-based care.
Yep.
A good example is cancer care, even heart care, things of that sort, where you have a dietitian, you have a nurse, you have a physician, sometimes social work as well, things of
Mm-hmm.
that sort. And a lot of times, to your point, we don't necessarily have that fitness component, right? We'll have the dietary,
Mm-hmm.
but not the fitness. And they really do hand in hand. I think we have to start and kind of back up a little bit. How about this? Healthcare. How do we define healthcare today? And I think a lot of people talk about being sick care medicine, right, versus well care.
Mm-hmm.
I think medicine has been set up in a certain way right now where prevention and wellness, one, isn't funded quite yet.
Mm-hmm.
And you can hear that from a lot of my colleagues. I mean, I won't, I will share this much. I talk a lot. I'm out there a lot because I can talk to my colleagues,
Mm-hmm.
and they say, yeah, it's a great thing, but you got to follow the money.
Mm-hmm.
And where is the money today? It's intervention. It's
Mm-hmm.
still more cath lab, EP, surgical intervention, stenting, et cetera, mitral valves,
Mm-hmm.
things for cardiac. Um, and there's really little amount of money spent right now, less than 5%, quite honestly, on the prevention side.
Mm-hmm.
And I think that's where there's that opportunity. And I think you're starting to see it. Quite honestly, in this last few years, you're starting to see more talk.
Mm-hmm.
And then you have folks, I don't want to say like myself, but yeah, I've seen it more and more where you're starting to see, and there's some CEOs out there really truly committing to more of that lifestyle
Mm-hmm.
slash prevention type model, where there isn't the money necessarily there yet. We sometimes call it value-based care. I'm very
Mm-hmm.
careful when I call it that, because it's more cost efficiency, if you want to call it that still,
Yeah.
with a nice wording to it almost. The value piece is kind of an interesting one. I like to call it health-based care almost, if we could, because the higher quality outcomes, the more you keep people from ending up in the hospital. That's where you should get paid for that. And I
Mm-hmm.
think that's where this opportunity really in the next, I think 5 years, this is where I keep thinking about the next 5 years right
Mm-hmm.
now. I do believe in the next 5 years or so, you're going to see more of this dynamic change because the world is unfortunately getting more unhealthy. I mean, if you already look at the rates out there, I keep looking I love statistics. I just always have. I'm very
Mm-hmm.
data driven, being an operations guy. I'm always looking at data. Is that we're at about 43 to 45% obesity rate because the last statistics really came out and right before COVID,
Mm-hmm.
and it's kind of delayed a little bit. So, because of COVID, everybody's talking about the explosion of obesity more and what have you. And I don't disagree with it. I think it probably has increased. I don't think it's
Mm-hmm.
decreased in the last few years. And with that, you still have, again, metabolic syndrome. I think the paper came out from Tufts. I put a little post out about a year and a half ago about, was it 90 to 93% of all Americans are metabolically unhealthy right now, quote unquote. And that's a concern. That's a concern for the U.S. as a whole, at least talking about our country, because frankly, productivity is what keeps the world going around. And if we're very sick as a nation in the future, and that's kind of the track we're still on, how are we going to be as productive? Yes, I think there's great technology coming out with AI and all that, and I think there's going to be a value to that. But you still need people, especially in healthcare. People is what drives healthcare, not technology. And a lot of the generation still prefer to see a doctor or a person face to face, even if it's like this.
Yeah.
They don't want to just have a phone call or some generated something telling you what to do, at least not today. So I don't see that changing. And frankly, going back to where fitness fits in is that I think we're going to have to kind of keep pushing. So I think you just had a conference with American College of Sports Medicine. I think it was, I noticed.
Mm-hmm.
I think we need to get more of these kind of folks together. We're just like the American College of, Lifestyle Medicine now, which is a little bit newer. It's a little over 10 years, almost 15 years old, I think. Great group. It's growing pretty rapidly, quite honestly. Functional medicine is another area of, things of that holistic kind of medicine. I think those are kind of things I think we're going to see more and more transition to, especially from physicians. If you talk to them, they're enjoying this side because they feel great about what they're seeing take place. And I think when you talk about burnout, I got to touch on that. Like, I think it's important because there's more reports coming out, like even yesterday again, that's talking about burnout. And I've seen plenty of it. I think I probably felt some of it myself, obviously, back in 2020. That's kind of what I think I was just kind of a little bit toasted myself. Because we do give ourselves, I think you're right. We're all caregivers. That's what I used to say to all my teams. I don't care if you're administrative or direct care. We're all caregivers because we try to take care of each other so we can take care of the community. That was always my slogan, basically. And we do put others before ourselves a lot. And that's great because we're very high empathy kind of an area. But if you don't have a way to manage that high empathy, you take in that stress. And it's hard to get out. And I think this goes where the fitness comes in. I think fitness is a wonderful way of relieving that piece so you can get on with your day and have a high energy and things of that sort. And I think that's where a nugget comes in too, Mike. I think the more we can talk about the value of fitness, right now, fitness doesn't necessarily can really bill. It's more private based, like myself even right now. But I think multi-D is where this is going to start more. I can tell you that there are places looking more at longevity centers. You've probably heard that word a lot. It's become a very, very popular word lately, longevity or lifespan. I think that's the other word for it. And then there's health span, which is, there's longevity, living long time. And then there's actually the other part, which is quality of life, which I think is probably as important, if not more important than length. Yeah. You don't want to be, retiring and all of a sudden unable to do hardly anything. And be dependent on the health system versus enjoying your life, hopefully. And I think this is where fitness really has an opportunity. But I think right now, and I'm just going to be blunt about it, it's a hurdle that's pretty high still. But I think there's a lot of physicians out there, and I'm probably going to be one of them that keeps tooting this component where nutrition, fitness, sleep, stress, and then obviously the emotional well-being component comes into all that. And I think it's like a trifecta to me because I look at what I do every day for myself, and that's how I always try to look at with my clients. Because I use a platform, quite honestly, an app that actually helps them create their own models of fitness, but also track a lot of their other biometrics component and their food every day. So we can track a little bit of everything. And I can tell you that my most recent client's a nurse, and she's so excited her triglyceride level, and I don't mind sharing this part of it because this is this piece of it, but she went from around 150, which is a high level, down to 58 without any kind of, it was basically fitness was a big component. She had not done a lot of workout. She does 35 minutes a day now, and she loves it. Her husband has now joined her as well. He's a physician. And it is the best thing. I mean, it was so much fun to see, because that basically triglyceride is one of your factors of metabolic health. Yeah. And to see her drop almost from 150 to 58, which is actually, when you look at Mark Hyman and other physicians who have a pretty good name out there, the goal is under 60 is an ideal state, not under 100. 100 right now actually is the lab kind of metric of good. But really, most physicians say between 60 and 70 is a really good level. She's at 58 now. And that was in 8 months. Yeah. So, and it was just basically tweaking her diet, her nutrition model a little bit, and then exercise. That was really the two big components. So you have to contribute between the two of them, that win. And her muscle mass, and I think that's a really important part too, has improved. Her tone, she loves it. she just turned 60. So, I mean, from that perspective, it's not as easy to do those kind of things, but yet she's rocking. And I have to tell you, as being a provider, there's nothing better. And I can see why physicians and nurses and truly direct care love what they do, because there's no better feeling to actually know you made an impact on somebody's life. And I think the fitness professionals, I think their component into this is key, because again, the way I'm doing it right now is a decent model, but I think more robustly at a health system level, there's so much more opportunity. And that's where I'm going to commit a lot of my time, honestly, over this next chapter of my life, trying to get folks like yourself. I mean, you're doing the same thing, trying to advocate. I think that's a good word for it, is advocate, but also show that it works, so that when we can get it more mainstream, where fitness experts can work side by side with nurses, with the dietitians, et cetera, et cetera. They are a valued partner versus more of I don't want to call it fringe, but, and I think it kind of goes into a little bit of a talk of what do we think about fitness experts, right? Because in healthcare, majority of healthcare professionals have, bachelor degree, master degree, et cetera, et cetera. I mean, it's probably one of the most highly, educated sectors in any industry. And that's not always the case with the fitness side. However, I'm also very sensitive, because I've met wonderfully smart, intelligent fitness experts who may not have a degree, but have those certifications from ACE or pick the national certification, who do not do a wonderful job. And I think there's that barrier there sometimes too, where it just kind of is sometimes, and I've seen it, where you have one that says, well, you're not this, so therefore you don't meet the standard, despite that they do. And I think there's some of that stigma, maybe that's part of it. And I don't like to say, and it's not to be negative about it, it's just to say that there's this component where healthcare just hasn't recognized yet the value of, like you bring up, this great group of folks who bring a lot of knowledge, and they do change lives.
Yeah.
And I think that's where this chasm, we call it sometimes, where it needs to be crossed. I think, again, we're seeing this slowly change because of what this last few years has caused. I think it truly has been a pivotal moment in healthcare, where you're now seeing just things have to change. Healthcare, as a lot of people say, is broken, and it can't be sustained the way it's going.
Yeah.
And I think fitness is going to be a big part of it, just as much as holistic care, if you want to, and that's part of it. I truly believe that, Mike.
Yeah, absolutely. And to your point, I mean, you are kind of on the leading edge of this journey with a lot of other professionals that do believe very strongly that, fitness and exercise professionals have a place in healthcare. And I know a lot of our audience is going to want to follow your journey. So where's the best place to go to find out more information about you and all the great work you're doing?
Sure. Well, if they want to learn a little bit more about myself, my values, the company itself, my journey, some of my philosophies, actually, they can go to my website. That's www.descendingupwards.com. From there, all the other social media components you can find, but that's really a good place to start. And again, it's just more of a platform to start. I really have some ideas about direct to employer type models of care. That's something we could always spend a lot of time. I mean, there's a lot of things we could talk, probably have multiple episodes about things, but
Right.
there's a lot of things. I think that's a part where I talk to chief wellness officers, Mike. I have a really close friend who actually is exercise. He actually I won't give too much away yet, but he was a pretty big name actually with college football. He was an athletic trainer who now is pretty much a chief wellness officer for a pretty major organization in the world, actually. And he's doing some really fantastic things to improve health. And a lot of it has to do with wellness, again, to the point of what you bring up, the fitness component with nutrition, just living well. So I'm seeing more of these kind of things where you're seeing direct models of care. And I think this is where fitness fits into it. I truly do. It's not just a physician-led or nurse-led. It can be, like, again, an athletic trainer. This is a great example of that, who I can only tell you he's part of a major organization, international-wise, helping lead wellness for a multinational company. And it's impressive to see what he's doing. So yeah, I think the journey is just really kind of the tip of the iceberg right now for a lot of folks. And the more I get to meet and just kind of get out there, the more excited I am about exactly what you're advocating for and what you're focused on, that wellness paradox. I like that. I like that title, quite honestly. I think it was really catchy when I got to hear about it. And I really agree with what you're trying to say, is that it is frustrating a lot of times. When I read your bio about why you did what you did, it can be very frustrating, even as a healthcare executive, when we think about, hey, we want a healthy community. But one of our biggest, our goal is frankly to take care of it from an acute perspective. It's not necessarily from a non-acute. Despite about 80 to 90% of all care really being outside the hospital walls, quote unquote, a lot of our time is focused inside because that's where a lot of the resources are spent. And I think that's part of the dynamic that needs to change. And I was talking to a cardiologist, and maybe I can bring this up really quick because I love talking to doctors about things. And, even if we did change the paradigm where we kind of got a lot of people to go more healthy living, more lifestyle focused, there's still going to be plenty of volume, quite honestly, at the end of the day, because there's genetic deform. I mean, there's all kinds of things out there that's just natural. I mean, it's just life.
Yeah.
Genetics does play a part in our health. However, as we know more now today, as research keeps coming out, that 70 to 80% of it really is epigenetics and our lifestyle that impacts how our genes function. But there's always going to be plenty of volume. And with our aging population anyway, the hospitals are not going to be not busy for a good while. So I think there's that component to look at and say, how can we manage, especially with I think I'll use put my healthcare executive hat on for a second, Mike, is that we are seeing an aging group of physicians, an aging group of nurses. Okay. The average age of physicians, I think, is somewhere around 56 right now. That's a little bit of a concern because a lot of them can actually opt out soon.
Yeah.
Nurses are somewhere between, when I was running my hospitals, anywhere between 50 and 55. And this was only a few years ago. And with the burnout, quote unquote, increasing still, you're seeing more and more of this. So there's going to have to be an incentive soon, and AI is not going to be the solution anytime soon. I mean, we're talking a lot about doing more paperwork administrative, which is great. I think that'll help. But if we're not going to have the people, especially in the acute side, we've got to do something to keep them healthy so they don't necessarily take up all the inpatient side, so we can get them into the ambulatory care and just keep them healthier. Yeah. And I think that's where, again, I think there's this beautiful moment. I don't use that word beautiful, I guess I don't use it too often. Where I use 5 years kind of mentality that we're going to see some kind of a flip. Yeah. And I'm truly optimistic. I'll use that word as well, that there's something that's going to be a trigger that says we can't keep going down the same route. And, I just want to be part of that because I really do care. I love healthcare. My mom's a nurse, 40 plus years. So I grew up in a family of nurses and educators primarily. So it's always been my way to be a coach, a mentor, and really help communities out. And if I have an impact on that from both a direct and I call it indirect administrative type way, then great. I feel great about my life and my career still. And it happened to be my own health event, to your point early on, that has kind of triggered this other side of me to say, hey, I think there's another way to still improve the health of our community and our society. And it's not just through traditional healthcare. It truly is a different model of care where I think fitness, more focus on the lifestyle component, and it's more broad, as you know. It's those key components of sleep to nutrition to exercise, stress management, well-being, as they call it. I think those things, as we kind of keep focusing on that more, we'll have a healthier society as a whole, emotionally wise, emotional well-being as well as physical. And I want to say I remain optimistic. I'm always and people call me an optimistic realist because I think I am. I know reality-wise it's not going to be quick, but I'm optimistic that we will continue to see positive change.
Absolutely. And you and the work you're doing, being a big part of it. And to bring this to a close, and this is a question I'm really excited to ask you because of where you spent your career in healthcare as an executive. But I always end the podcast on the question of what I consider the wellness paradox is this trust, interaction, and communication gap that exists between exercise professionals and the medical community. If you could take your experience and everything that you've talked about today and sum it up into one succinct piece of advice for the fitness professionals that are listening to close off that gap, what would it be?
Yeah, that's a great question. What would that be? I would say be empathetic to what every provider is going through right now.
Mm-hmm.
If you can do that and kind of recognize where they're at and get to where they are, recognizing that they may not see what you're going through because you are trying to break through that barrier, if you want to call it that to some degree, but recognize what everything you're hearing out there is real. So physicians are getting frustrated because of all the paperwork, whereas a lot of the exercise professionals don't necessarily have to go through all the insurance stuff and all the administrative push to say, you need to see this many patients, those kind of things. There's a lot of pulls and pushes. And I think if they can understand that, and if we can educate, and I'm happy to do those kind of things as well, to say, hey, here's what is going on in healthcare on this end right now. If we can meet in the middle and say, hey, here's the value proposition you bring. And you would probably be more part of the team because you can't bill, not today. However, you have a value add, just like an RD or a social worker. RDs can bill sometimes for certain things, like diabetes education, et cetera. But social workers don't necessarily bill, but they're a big component of the team when it comes to what's going on in their social network with the family and what have you. There's that same part of this, fitness. Okay, what are you doing every day? It doesn't have to be weightlifting. It doesn't have to be necessarily going crazy on cardio. It can be just again, taking the holistic view and say, all right, are you tracking steps, for example? That's an easy one to look at. I do that with all my clients. They all wear wearables basically. And I say, hey, let's focus on that. Let's get you to a certain point. That's a pretty easy win. And as we know, walking is a fairly good, almost zone 2 level type exercise for a lot of people. And I think if you kind of do that, Mike, as fitness professionals for right now, I think you can cross that chasm, as we call it. It's just going to take some time. I think you're going to have patience, but I think you have to have a recognition of where the challenges are right now on the traditional healthcare side as an exercise professional and say, where can I add value? It may be, like I do, where I collaborate with a primary care doctor, but I don't necessarily get paid to do it. It's just part of my thing I want to do to make it easier for the client, or as they call it, patient for the physician. Well, you have clients too as fitness professionals. That's why we call them clients. Well, why can't you do the same thing? Have you thought about that? Have you thought about actually interacting with their primary care doctor? I'm not unique in that, I don't think. But I have no problem. And maybe that is where another part comes in is there fear in exercise professionals from trying to reach out to physicians because they can be sometimes intimidating.
Yeah.
I've worked with them for 20 years, so I'm very comfortable in that world. Not everybody is. I think that's one of the things where you see that white coat, effect when you walk into a doctor's office. Like everybody seems to get it, where your blood pressure goes up and all those kind of things. Maybe an exercise professional has that kind of you have to think about those things and say, hey, I got to get out of my comfort zone. I think that's the other thing with exercise professionals is that they're very comfortable in their space. But when they all of a sudden maybe try to enter into the healthcare model as it is today, it's a really different space. It's not as flexible. It's much more regimented, very standard of care. And it's kind of like you would do with when you're creating a workout model, for example. But it's more strict because, again, how you get paid is different than how you get paid as an exercise professional. So, again, I think it's more of a recognition today. And I think also the opportunities to do partnerships and say, hey, I have my client that I'm trying to work on. I understand they have these things going on. How can we work together? And I'm happy to provide information like I do. I'm happy to share stats. Here's what's going on with their resting heart rate. Here's what's going on with their nutrition, if someone wants to see that. This is how we're trying to lose weight, et cetera, et cetera. I think that's where your fitness professionals have that opportunity, just like I am doing, is to kind of be the one that reaches out.
Yeah. I love that you started it with empathy and talked about building value. I think that's so important. Drew Smithson, thank you so much for joining us on the Wellness
Absolutely.
Paradox.
Yeah, it was a great time. Thank you very much, Mike.
Well, I hope you enjoyed that conversation with Drew as much as I did. If you found it insightful and informative, please share with your friends and colleagues. Those shares make a big difference for us. Any information we'd like to share with you from today's episode can be found on the show notes page. That's by going to wellnessparadoxpod.com/episode 119. Please be on the lookout for our next episode when it drops in 2 weeks. And don't forget to subscribe through your favorite podcast platform. Until we chat again next, please be well